My name is Mr. Jai Relwani. I am a trauma and orthopaedic surgeon at East Kent Hospitals. I have a special interest in shoulder and elbow surgery. Patients who have arthritis in the shoulder will often come with pain that affects their quality of life. They've tried non-operative treatments and have failed to relieve the pain. And in that group of patients, we can offer them an operation called a shoulder replacement. Shoulder replacement essentially involves changing or replacing either part or the whole of the shoulder joint with a metal and plastic prosthesis so that the pain-producing surfaces are taken away and it gives you good pain relief and function after the operation. So the operation is primarily carried out for patients who suffer from arthritis of the shoulder that has failed to respond to non-surgical measures. It is often done also for patients who have fractures of the shoulder, where the shoulder is broken to an extent that it can't be put together. A small number of people will end up with a shoulder replacement when they have no rotator cuff as a result of wear and tear and can't function, where we then change the mechanics of the shoulder and put in what is called as a reverse shoulder replacement. So those will be the three main groups of patients who will have a shoulder replacement. Most patients who have a replacement will require a period in a sling for up to 3 weeks where they are limited with the kind of heavy activity that they're allowed to do. They can do things that involve little movements of the arm and the hand, but we try and avoid any big movements of the shoulder for the first 2 to 3 weeks. They are then put through a physiotherapy program, and they find that the return to function occurs quite rapidly after the first few weeks. They're driving usually by the end of 6 to 8 weeks. They are 70% better by the end of 6 months, at which point they really begin to like their shoulder. But it continues to improve for a couple of years after the operation. The major indicators or reasons to have a shoulder replacement operation is for patients who have pain and limitation or loss of function. Once you've recovered from your shoulder replacement, the single major benefit is that you can get rid of all or most of your pain. One can return to pretty much most activities that they were doing before the operation, including certain types of overhead sport, things like swimming, cycling, golf. They're quite comfortably done. What you want to avoid after a replacement procedure is physical activity that involves very heavy loading of the shoulder. So if you were going to the gym before this sort of an operation, you could go back, but you don't want to do repetitive heavy loading of the joint because it is a mechanical device and you don't want to wear it out quickly. But apart from that, there are very few restrictions in terms of what you're allowed to do and what you can actually achieve with the replacement. I think if you've had pain in your shoulder that hasn't responded to simple non-operative measures and you feel that pain and discomfort is affecting your quality of life, then the simple thing to do is to speak to your GP and ask for a referral or contact the hospital directly, where we can arrange for you to be seen, appropriately investigated, possibly even further trial of non-surgical measures, which often works. And then if all else fails, you could be considered for an appropriate type of shoulder replacement.